Right. Good evening, everyone. My name is Karen Miner Hurd, and I want to welcome you to our recap insights and action steps on Dr. Hartig's talk on inflammation. So let me just share my screen here and pull up some things for my visual learners. All right. And this is just a lovely view of the St. Johns River. Hold on. Okay, inflammation and ascites. Now, for those of you that don't know me, I am a certified wellness educator and currently working on my certification in brain fitness coaching. So, inflammation is one of those root things. What we're covering tonight is what inflammation is, what it's not. I'll give you a few slides you can screenshot. And everybody who's an attendee will get Dr. Hartig's handout. So after you've listened to this webinar, I will get you the handout for her that she wrote. All right, it's not AI generated. She actually writes it. We're also going to talk about some action steps you can start right now and some programs that really are effective. They're non-inflammatory and really help you lay that really good foundation for your life. For those of you that aren't aware, I have partnered with the Well Builders Network and Dr. Hartig, it's her network, and once a month, on the third Thursday of every month, she offers a webinar on different topics. So they are always at 8:30 p.m. Eastern, so whatever that is in your time zone. And then the following Tuesday, we do a recap and action steps. She covers a lot of information, including Q&As. So it's just they're phenomenal, and she always has a handout that is she writes specifically as a takeaway for that webinar. These have been extremely popular. We had 800 people on the last webinar, over 800. So Dr. Tonya Hartig is a functional medicine doctor, and she says, you see me highlighting it here, not feeling sick is not the same thing as being well. So if you've been with me at all and you have seen our wellness continuum, a lot of times your doctor's job is to get you unsick. And it's not their job to get you to optimal health. Okay, their job is to get you out of an acute state of disease, as many of them help manage a chronic state of disease. But wellness, that's up to you. So, what functional medicine does is it's a root cause approach, asking why. If there's an elevated marker or blood marker, for example, that's too low, why? If there's some pain, that's why. If there's fatigue, why? If there's digestive issues, why? As opposed to, oh, you have acid reflux, here's the drug for it. A functional medicine doctor will sit there and say, well, why is there acid reflux? And they'll work with the symptom because that's where some might be where you start. But they're always asking why, because if you can get to the root cause, the fruit, right? You get to the root, the fruit will often take care of itself. So it's looking at poor lifestyle or stress as part of the root cause. That's the more inflammation that you get, more disease. So we just talked a little bit about this here. Now, when people come to me, oftentimes there's a symptom. I'm feeling depressed or anxious, or I've got fatigue, or I just don't like the way my skin looks. And, what have you got for that? Well, that's very much a medical type of approach. I have wrinkles. What do you got for wrinkles? And I want to find out what's going on in your life that the wrinkles are maybe worse for your age. Does that make sense? So yes, we can help with the with the reason why you came, but we also, want to work at the root as much as possible. Now, there's two types of inflammation that Dr. Hartig addressed. The first is acute inflammation. Now, acute inflammation isn't the problem. It's actually a good thing. It's your body's warning signal. It is short term and protective. So, for example, pain. Yeah, I've got pain, I've got to rest, right? You'll ice it, you'll put heat, you'll work on bringing that inflammation down. And as you're doing that, you're maybe bringing healing to the muscle or a joint. Swelling kind of cushions the area if you want to think about it that way. Obviously, we don't want to go too big. We want to keep that swelling in its rightful place. If it gets too big, then it becomes a different type of problem. But swelling in and of itself, right? Maybe you cut your finger. If you notice it's a little bit red, a little bit swollen around it, it's rushing cells to that tissue to heal. That's part of what that swelling is. It's also alerting your immune system, hey, 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 warning, 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 to get that immune system into action. Fever is there because some bacteria do not tolerate the heat of a fever, or viruses don't tolerate the heat. So fever, again, within a range, right? We're not talking about getting into 100, 304, those kinds of things. But fever can help fight infection. In fact, there was a doctor, he wrote the book, Take Charge of Your Child's Health. His name is Dr. George Wooten. He's a functional pediatrician. I think he had 12 kids, maybe more, maybe 15, himself. And he would always, again, if the child's fever was relatively low and the child was overall happy, he wouldn't treat the fever because he knew that fever within a certain range, right, and short-term acute fought infection. Acute inflammation resolves on its own. For example, you sprain your ankle, you've got a little bit of swelling, it hurts. So you elevate it, right, so the swelling doesn't get worse, so it serves its function and doesn't become a problem by itself. You're resting on that ankle. When the ankle is healing, the swelling is gone, it doesn't linger. That's acute swelling, acute inflammation. Chronic inflammation, a completely different animal. It's silent oftentimes until it manifests. We'll talk a little bit later about some symptoms you can look for that are indicators of silent inflammation. It damages tissues over time. It is linked to serious illness and it doesn't go away. It doesn't resolve on its own. It becomes a loop. So tonight we're going to talk about chronic inflammation and what we can do about it. So why is that a problem? I mean, so you're a little puffy. Well, wait a minute. We don't really want something, it's kind of like, well, why is credit card debt a problem? Well, if it's, maybe a couple $100, it's not a problem. But if it's a couple hundred, that becomes 2,000, that becomes 10. Now it's a problem. When it was small, we could take care of it. That's exactly the attitude we want to have about chronic inflammation. When it's small, we want to take care of it. When it becomes a big problem, it's linked to disease like autoimmune disease, all of them, fibromyalgia, gout, insulin resistance as a result of chronic inflammation, also becomes a loop, and now you're in type 2 diabetes, heart disease, cancer, arthritis, dementia, all of them. So dementia, Alzheimer's has an inflammation or chronic inflammation component. Anything ending in osis or itis is a result of inflammation. Now, and fat cells, by the way, obesity increases inflammation, which increases obesity. So that's why inflammation is a problem. It becomes a feedback loop of the wrong kind. So cytokines are your body's signaling proteins. In the acute inflammation we spoke about just a couple minutes ago, they're not a problem. They're going, hey guys, come on, we got a problem, let's take care of it. That's cytokines saying, go get them. They're being good guys. But when there are too many or they don't stop signaling, that's a problem. Too many, you've got a cytokine storm that can overwhelm the body, becomes very serious. If they don't stop signaling, now you've got chronic inflammation and we've got a different type of problem. I hope you guys can see this. Let me see if I can make this bigger here. I don't think I can I go full screen on here? No, I don't think so. So I apologize. I'm going to see if I can't make this a little bit bigger. Can I make this bigger? No, we're just going to let me, no, that's as big as I can go. So some common symptoms of chronic inflammation. Now, if you went to your doctor, say, I've got some like lower back pain and, I'm just kind of tired, what would they tell you? Sleep more and take some Tylenol for the back pain. If that's not enough, take some ibuprofen. It's an example of the medical community. I'm not faulting doctors. It's how they're trained. It's how that system is set up. Okay. Taking what could be in functional medicine or naturopathic medicine, Why is that there? And ignoring it and treating it and just making the symptom go away when the symptom should be paid attention to, right? So we don't get into bad problems. So, what are some common symptoms of chronic inflammation? Again, this is not medical advice, right? Nothing I'm saying has been evaluated by the FDA. It's my opinion. I am, to the best of my ability, talking about what Dr. Hartig did, and these are a few of my own notes. So, I went and did a little more research on symptoms of chronic inflammation. This is to help you be more educated. But some common symptoms: pain and stiffness, not from an injury. So, yes, if I drop something on my toe and my toe hurts, well, that's a clear. But what if I wake up in the morning and I'm just kind of like stiff and painful? I didn't really do anything, right? That's a sign of inflammation, not just age. Okay. Anxiety or depression, mood, brain fog, cognitive issues are signs of chronic inflammation. Fatigue or insomnia, either way, right? The opposite. I can't sleep. I don't sleep well. Uh, Chronic inflammation. Stuck at a weight. You can't seem to budge this weight, and maybe you really are doing all the right things, but you can't seem to budge the weight. Insulin resistance is your body, your cells are not receptive. They're not getting the signals from insulin that you've eaten, and it's time to move the glucose into the cells. So sends out more insulin, and that's where we get some of the crashes. Long term, we are looking at that's part of the weight issue. These are all become loops, right? But insulin resistance, unchecked, untreated, you're looking at type 2 diabetes. Puffiness, bloat, fluid retention. When somebody's just like puffy. If you're in our Woman Wise Ageless Champions group, or if you're already a member, you're in my VIP group, I have some pictures of some people that did the puffiness in their face between dealing with the inflammation and not are incredible. Looks like they lost 25 pounds. But puffiness, bloat, fluid retention can be a sign of chronic inflammation. Trouble balancing. You fall. I just kind of lost my balance. Chronic inflammation. Dry eye. If it's too much, it becomes Sjorgen's disease, which is autoimmune. But if you're like you dry eyes, hmm lower back pain. Now this is surprising. How many people have got lower back pain? Right? Certainly, go to the chiropractor. Always get checked out. Listen to your intuition. But lower back pain as a sign of chronic inflammation. Hardening of the arteries, because your body sees this inflammation as what? Something's wrong. I got to fix it. And your body it won't stop signaling. So tissue damage to tissue. Bleeding gums. Blood clotting issues. Now, if you've experienced any of those, you absolutely get checked out, right? But diarrhea, constipation, like fatigue, insomnia, you're seeing the opposite extremes of a digestive issue. Fever, just like non-specific fevers, all right? Contributors of chronic inflammation can be allergies. Allergies are very inflammatory, and that's why it's a big deal. Sometimes people have food allergies or sensitivities, and they go, well, I just get a little bit of a runny nose. I'll just eat it anyway. I understand, but you're contributing to inflammation, which law has some severe long-term consequences. But what are these long-term consequences? Heart disease, you see it in the hardening of the arteries or the blood clotting issues. Cancer, arthritis, autoimmune disease, all of them have inflammation. There's a debate which came first, the chicken or the egg on that one. Was it the autoimmune disease that set off the inflammation? But I believe that newer research is showing that their inflammation on some level is a contributing factor to activating or triggering perhaps some underlying genetics, right? So chronic inflammation pulled the trigger. Fatty liver disease, not non-alcoholic fatty liver disease. By the way, alcohol addiction, serious contributing factor to inflammation. Type 2 diabetes, which we mentioned earlier. Dementia, dementia, including Alzheimer's, are all symptoms of chronic inflammation. You can see why it's such a big deal. Blood work to ask for. Now, like I said, you can look at some of these symptoms. You go to the doctor, he goes, I want some blood work. Your insurance may or may not cover it. doctors like Dr. Hartig will order blood work, and even if it's out of pocket, you need to know because they're going to draw for different things than your doctor will. Your doctor's often very cognizant of what insurance will cover and not cover, but a good one to ask for is CRP, C reactive protein. It's a measure of systemic inflammation. This is excellent. Some of your doctors will do it anyway, some of your insurance covers it, but this is a really good one. In my own life, when I was battling PTSD and under a lot of stress, PTSD is a stress disorder, my C reactive protein level was at a 6. More than 1, it's considered moderate. 6 starts to get into the severe. Okay. But I was at a 6. When my daughter, who battles SLE, systemic lupus, one of the things I asked for when they were doing blood work, because she had the swelling and then the nonspecific fever, all of that, I said, I want to see reactive protein. I knew about that one. I said, I want you to draw for that. Hers was 30, almost 35, 35, almost 35. Okay. So HSCRP, a lot of your doctors will draw for it. Insurance won't always pay for it. I don't know that it's expensive, but it's an important number and it's an easy one to understand, right? More than 1, you've got an issue. 3, you really need to start paying attention to it, right? Homocysteine. Homocysteine is interesting. It's also a byproduct of your digestion, but high homocysteine links to inflammation. It's also high homocysteine is an issue in heart disease. It may also be an issue with the MTHFR gene mutation. So homocysteine is an important number. ESR, erythrocyte sedimentation rate. By the way, this is a standard test in autoimmune disease and like lupus. So it measures how quickly red blood cells settle. Higher speed signals body-wide longer-term inflammation. So you can ask your doctor for these. They probably will do the first 2. I'm not sure about the ESR. This one takes a longer time for the blood work to come back. Okay. So what are some things that you can do when it comes to, so there's getting your biomarkers done. We just did here, I'm backing up real quick. We've just done some of the symptoms. You're like, great, now what? And you go ask Dr. Google or you go to chat. And you say, tell me what I'm supposed to do. Well, tell chat you're not asking for medical advice. But chat isn't always right. So what we do is we've gotten a couple of simple steps to get people started, because even if you've got chronic inflammation, you can start building in habits. The first thing to do are your food choices. Okay? Food, and our culture is very inflammatory. We spend a lot of time sitting. We spend, we eat a lot of ultra processed foods. When you go to a restaurant and they're frying in oil, they're not putting fresh oil in every time. They're reusing that oil. That's extremely inflammatory. The stress that we're under, inflammatory. So we've got highly inflammatory lifestyles in North America. So some things that you can do right away: refined sugars and processed foods. We'll talk about how much sugar you can have every day. But these not only spike blood sugar, they trigger inflammatory responses. Industrial seed oils. Now, I did a little bit of a deeper dive in this. And industrial seed oils got a couple of issues with it, especially when it's in ultra processed foods. First off, it's the heat. Heat changes the molecular structure of oil, and that can cause its own set of damages. That's one thing. Secondly, omega-6 fats can be healthy for you. Okay, they can actually lower inflammation. But like cytokines and some other things, it's when they exceed that role, they become inflammatory. Instead of becoming the solution, they become the problem. And industrial seed oils are often processed, right? The mass-produced seed oils are often processed with hexane. It's how they get the oil out of the seed. So hexane is another type of issue, right? It's a neurotoxin. And again, it's not the one time you ate it. It's just, it's in everything. It's the quantity that we deal with. So you can just start with just one of these swaps will start working on. And so again, if you have a little bit of vegetable oil that you made some salad dressing at home, probably not a problem, all things being equal. But if you're, getting the vegetable oil-based salad dressing from the store, you're under high stress and you're eating French fries that you got from the fast. Now you've got a super inflammatory meal. Does that make sense? You see the difference? Ultra processed foods, if it doesn't rot, don't eat it. See how simple that was? A lot of the grocery store is ultra processed. I want to talk about a minute what that is. If I peel a carrot, I've technically processed that carrot, right? If I get some wheat berries or millet, I have to eat gluten free. If I eat and I put some millet in a grinder and I grind it and then I make something with my freshly grind millet flour, I've technically processed the millet. That's not the issue. It's the ultra processed. It's that happy meal that you can buy, or the kids' meal you can buy at a fast food place and it never rots. Try me on this. Go buy one, don't eat it, and don't refrigerate it. Watch how long it lasts. It's the foods that never rot, ever. And these are the highly packaged foods. Okay, these are very damaging. In addition to the heat and the lack of nutrients, they've got trans fats, which are inflammatory and dangerous, and the chemical additives. Anything that your body can't deal with as food, your body treats it like a toxin. And what's it trying to do with toxins? Signals the immune system, raises inflammation in order to, you see all the processes that happen. What's an anti-inflammatory food? Fruits and vegetables, but especially berries and the lower sugar fruits. One of the things Dr. Hartig mentioned in another webinar that I was in is in recent, probably within about the last 30 years or so, they have made fruits sweeter than they used to be. That's part of the issue why I'm thinking nobody in America is fat because of apples. But apples are sweeter than they were years ago. So probably sweeter than when I was a kid, which is why now you kind of have to watch them. But they are very rich in antioxidants, especially locally grown, especially organically grown. So if you can get locally grown, organically grown vegetables and fruits, bonus. If you can't, still better than something that's not fresh. But they're rich in antioxidants, and those can neutralize the inflammation signals. Fatty fish, which are higher in omega-3s, so mackerel, sardines, right? I actually was at a restaurant and they had a charcuterie tray, which is 3 different kinds of sardines, right? So people are eating sardines again. And it's funny, I have a Polish background, and that kind of fish was what everybody ate. So those types of foods, um, walnuts, healthy, fresh, not stale, and not super cooked. When they cook it, it changes the oils, and that makes them inflammatory. Turmeric. If you notice, like Indian cooking foods, there's cuisines that these are naturally occurring, but those kinds of things are very well studied and have anti-inflammatory effects. So this is how you can balance it. Again, it's not the one time you did something. It's just in our culture. So it's not the one time you did good something, that's good. It's not the one time you ate something, bad. It's the culmination over time. So you can either work it in your favor or work it against you. What do I do for my meals? One of the things to know is that you want to eat 2 to 3 highly nutritious meals per day without snacks. Snacking, now in America, we were for a long time, the dietary advice was eat 5 small meals a day to keep your metabolism stoked. The idea was is if the action of having to burn the food would activate the metabolism. But with more advanced research and ongoing research, that advice doesn't really hold. Kids, for example, don't really need a snack. They don't need a snack like in children's church, that kind of thing. They actually don't. It's actually not good for them. So 2 to 3 highly nutritious meals. How do we define that? at least 30 grams of protein per meal. Most people under the age of 40 do well at 100 grams of protein a day. Most people under the age of 40 do well at about 100 grams of protein per day. And the older you get, the closer you need to get to that, because the older we get, the less efficient our body is with protein. When you're about over 40, then you want to start looking at 1 gram of protein per pound of ideal body weight. So if your ideal body weight, if you're female and your ideal body weight is 140 pounds and you're over 40, then you want to get your protein grams close to 140 grams a day. And then drink extra water to accommodate that. Okay? If you're a man, you really are looking at a lot of protein. If you're a man, let's say you're 40 years old, you're really probably looking at closer to maybe 180 grams a day. A lot of protein. You want to make sure that for the entire day, you've got 35 to 40 grams of sugar. That's all sources. So if you eat a cookie, right, peanut butter and jelly sandwich, and an apple, you want that sugar across all of that. If that feels confusing to you, start with the added sugar and try to get the added sugar down to 20 grams a day. That's like, you put a little bit of jam on your toast. You look at that. Okay, that was that teaspoon. You have to measure it. That teaspoon was 15 grams of sugar. Pretty much at your added sugar for the day. This is where those tracking apps are really, really helpful. Notice it says sugar, not carbs. I wanted to address that. When you're looking at keto diets, they count carbs from all sources. Here's the problem with that. Some foods, like beans, for example, have some protein in them, very important fiber, and other compounds. They're not the issue. If you have highly sensitive blood sugar, then you're in a different category, and so you have to do it accordingly. But for most people, pinto beans, right, are not the issue. So counting the carb in a pinto bean isn't the issue. Sugar. So if you're going to look for a couple of things, track your protein, your sugar, and healthy fats. Okay, so I track protein, added sugars across all sources, and healthy fats. If you'll do that, you'll find that calories will come in line. That's a whole nother topic for another day. If you're with us in the Metabolic Energy Blueprint, which I'll talk about in a moment, we do this. It's part of what we do in the Metabolic Energy Blueprint. I apologize for the small screen here. So, managing stress. However you need to do that, you can join us in our Burned Out to Joyful, where we talk about stress management for 5 days, things that take just a couple of minutes. But one thing that you can do right now, breathe deeply. When we're stressed, we don't breathe. Stress is a huge driver of inflammation. So prioritizing stress reduction daily, very important. We already talked about changing your diet. We just covered it, but I'll recap it again here. Eliminating seed oils, no more than 40 grams of sugar from all sources, fruit and added. Eliminating ultra processed foods. Yeah, that probably means you're not going into the 7-Eleven to grab something to eat. Increasing your protein and healthy fats and tracking your macros, focusing on protein, healthy fats, and sugars, not just the carbs. Okay, and by the way, the little asterisk here, do not swap for artificially made carbs, sugars. Monk fruit is fine, it's natural. Stevia is fine, it comes from an herb. Fructose is even from fruit, ideally, right? But sucralose, it's in a lab and very damaging to brains. So stay away from the artificial stuff. Increase anti-inflammatory foods, berries, vegetables, and other non-inflammatory whole foods. Prioritize sleep. It's not negotiable. Yep, that means you're going to be turning off, if you're doing this is what we do in our Burnout to Joyful, turning off screens, preferably an hour before you go to sleep, but even half an hour. Yep, that phone is down. You want to read? It's an old-fashioned book with something called paper. That's what you're doing. But prioritizing sleep, giving your body that time to rest and repair, and adding targeted supplements. The beauty of targeted supplementation is It's designed for absorption, and they can help tremendously when diet alone is not enough. But the other thing is, because food is not as nutrient dense as it was even 30 to 50 years ago, your grandmother's food when she was a child was more nutritious than the food is now. So supplementation overcomes that. And when your body needs extra help, supplementation provides that. Now, I want to go just real quick before I go on to some supplement programs. If you are looking at, well, I need a diet. I need to know how to do that. We talk about that in the metabolic energy blueprint, but look up Mediterranean. Mediterranean and de-emphasizing some of the grains, or you can put an anti-inflammatory diet. You're going to come up with meal plans, and those are pretty good. And they're pretty easy to, once you learn how to eat that way, it's pretty simple and you can eat everywhere with it. What are some programs I recommend? Well, the first is I use Shaklee products. I am a Shaklee ambassador. I've been with Shaklee now 30 years. There's several reasons why I recommend them. And we talked about in the Dr. Hartig seminar, the landmark studies, landmark 1 and 2, which showed, interestingly enough, lowered his homocysteine, which we learned earlier was just a marker, and lowered C-reactive protein levels in Shaklee users. Those two reasons right there, given the context of inflammation, is enough. But we have some really great programs. VitaLife, or the VitaStack, it includes now our non-inflammatory protein and a couple of key supplements, including omega-3s. So if you're new to supplementation, you're like, I just don't know what I want to do yet, that is a great beginning program. It is designed for that. Why do we do a program instead of just kind of hit or miss? Because programs are simple, they're simple to follow, they're comprehensive. We know that we're covering multiple bases at once. We're not missing, we're not creating a gap, trying to fix a gap. Okay. Ready, Set, Wellness. This is one of my favorites. Ready, Set, Wellness is the backbone of our metabolic energy blueprint. So if you want to get to a healthier weight, you want to deal with metabolic um, issues like, getting your blood sugar a little bit more stable. You want to, you just really want a good foundation program. You kind of want to do a little bit of an overhaul, but you don't want to go crazy. You want to have it in a structured way so you're not just, again, hit or miss, going to Google 3 days later going, I don't know, that didn't work. What am I going to do now? Ready, Set, Wellness is the answer. We start out with a 7-day healthy cleanse, which immediately some of the things that people talked about up here with symptoms, we really see people reporting immediately bloat going, pain going. We start to see brain fog lifting. So it's a really great non-inflammatory program focused on fruits and vegetables. And then over the next couple of weeks, we add back in foods one at a time. And we're looking for some of those inflammation triggers or other kinds of sensitivities. So it is a great, great foundation program. We have pretty good success with people achieving a healthy weight with it. And there's a lot of follow-up coaching. After Ready Set Wellness, you can move to RX for Life, but if you just want to talk to RX for Life, this is a comprehensive lifestyle program as well, and it includes, I've got a picture of it here, the RX for Life. Let me just kind of zoom it in here a little bit if I can for you. Do I know how to use the zoom? All right, RX for Life includes the Life Strip. It has Vivix. Vivix is a very powerful antioxidant, protects mitochondria, actually helps your body naturally increase mitochondria, protects DNA, helps manage blood sugar issues. Maybe I said that wrong, but we've had people that have had blood sugar issues report really good results. You see these here, omegas, and this is actually a C and E omega. It's a combination product. And then we've got the C and E and the B complex combined with the Vitally Gold and a few other things. Some of the nutrients in here are only available in this Life Strip. But you've also got the Nutriferon. Nutriferon is interesting. Interferon is a cytokine. It is, when it's behaving, and it's one of the members of the cytokine family. So this is an what it does in the body is complicated, but it's easy to take 2 a day. But it's really supportive of your immune system. And then we've got the Life Shake. The Life Shake is non-inflammatory, naturally supports GLP-1 levels, lean muscle, leaves you feeling full, and it's the healthiest fast food on the planet. So that is let me see if I can go over here and get to the, can I get there? I'm going to show you the Ready, Set, Wellness next. Okay. The Vital Life Stack. Vital Life Stack has a daily essential and a month's supply of the Life Shake. So it's a very, very simple program to do. And then we've got the Ready, Set, Wellness. I don't think that's available from this picture here. Okay, it's not on this picture here because that is only available as a join product if you're brand new to shackling. This has some extra bonuses with it, which is why we recommend it so much. If you want to know more, you're not sure about where it's going to start for you, reach out to me. I'll be happy to help you with that. We also have something called Meology, which it's a great assessment. It takes about 5 minutes. You can put in your numbers and your goals, and it's going to help create a program with you. And then we'll work to fit that program into one of these programs here. So I want to thank you for being here. Tonight was about education, empowerment, and taking the first steps towards truly feeling well, not just sick. And your next step, I've got you can have screenshotted some of the slides. If not, let me know. I can get you that handout. I'll get you those slides and the handout for tonight. But choose one action step. I strongly recommend the Ready, Set, Wellness because that's going to make the biggest impact the fastest for you. And make sure to join us next month, both for the webinar and the recap. Thank you so much for being here. It's been a pleasure to have you. God bless.